CPR quality. First, make sure that you compress hard, push hard on the chest, and the depth should be at least 5 centimeters, and it should be 100 to 120 per minute, and allow complete chest recoil. Minimize interruptions in compressions. Avoid excessive ventilation. Change compressor every 2 minutes or sooner if fatigued. If there is no advanced airway like ET tube, provide 30:2 compression ventilation ratio. Quantitative waveform capnography should be followed, which means if PaTCO2 is low or decreasing, reassess CPR quality. Shock energy for defibrillation. There are two types, biphasic and monophasic. Difference is that monophasic is 360 joules and biphasic is 120 to 200 joules. Next, most important is drug therapy. There are three types of drug therapies that are given in CPR, which are epinephrine, amiodarone, lidocaine. All these three can be given intravenous or intraosseous route. Epinephrine, which is given via IV or IO dose. Dose is 1 milligram every 3 to 5 minutes. Amiodarone, which is also given intravenously or intraosseously. The dose is, there are two doses. First dose should be 300 milligram bolus and second should be 150 milligram bolus. Amiodarone is antiarrhythmic drug which is of equal efficacy in CPR as of lidocaine. Lidocaine, which is given IV IO dose, first dose should be 1 to 1.5 milligram per kg, second dose should be 0.5 to 0.75 milligram per kg. Advanced airway should be done via endotracheal intubation or supraglottic advanced airway to secure ventilation. Advanced airway, when you have to make sure it is one breath every 6 seconds. So you have to give one breath in 6 seconds, which is 10 breaths per minute, and continuous chest compression. How to know if there is a return of spontaneous circulation? You have to check PaTCO2, which is typically more than 40 milligram, and you have to continuously check pulse and blood pressure. You will also see spontaneous arterial pressure waves with intra-arterial monitoring. Very important to know what are the reversible causes, which are very important to treat in CPR in step 8, which is hypovolemia, hypoxia, hydrogen ion, which means acidosis, hypo or hyperkalemia, hypothermia, tension pneumothorax, tamponade, cardiac tamponade, toxins like in uremia, pulmonary thrombosis, coronary thrombosis. Let's review each one by one. So how are you going to know that it's hypovolemia? when patient's blood pressure is low. And how do you treat it? Hypovolemia, you have to give intravenous saline, or you can also in some cases give lactate solution, Ringer's lactate. Hypovolemia correction is done via intravenous route. Hypoxia can be treated by giving oxygen. You can assess if patient is hypoxic by checking saturation. If it is in lower 90s or 80s, that is hypoxic person. Hydrogen ion acidosis you have to correct with by giving sodium bicarbonate. How to treat hyperkalemia? Hyperkalemia can be treated by giving potassium oxalate, K-oxalate, which will eliminate potassium from the blood system. And vice versa, if you want to treat hypokalemia, you can give potassium chloride tablets or potassium in IV saline. How to treat hypothermia by external warming? You have to cover the person and treat hypothermia by external body warming. Tension pneumothorax is when there is a valve which causes a person to have respiratory arrest. You will know by increased pulse, and way to treat is giving chest tube. You have to apply a chest tube in the chest to release tension pneumothorax. Cardiac tamponade is by releasing the right heart pressure by putting a needle in the right heart area, and you can release the cardiac tamponade. Toxins, like in uremic patient, there are excess toxins. You have to treat toxins by giving more IV saline and treating antitoxins. So pulmonary coronary thrombosis is by giving heparin. Heparin is a blood thinner that will release the thrombosis. So these are the most important CPR monitoring conditions.